Hey, I'm Dr. Tom Unger. I've worked with Locker Room Doctor for the last couple of years, explaining to regular guys that struggling with mental health concerns is a pretty normal part of life these days. It's funny how much we learn over time. Now, we know for years that players stayed on the ice after suffering a concussion. Some may have thought the injury wasn't real or could be played through, with the idea to try and tough it out. Advancements in medical science and brave players coming forward taught us just how dangerous this is. While we can't see a concussion on the ice, we can recognize the symptoms and make sure the player is benched. Toughing it out with any medical issue is just a bad move. Mental health seems to be the latest frontier where people still don't universally recognize it's a medical condition like any other. This is kind of surprising because mental health disorders are one of the most common health problems in Canada, affecting 1 in 5 of us. Odds are a number of people you care about had or are still dealing with some form of mental health disorder. Maybe part of the problem is our tendency towards concrete black and white thinking. We want to see it to believe it. Particularly with our health, we want a diagnosis to be certain, a definitive assessment of what's going on. But these days, if a player is showing signs of a concussion, no one thinks they're faking it or blowing it out of proportion. The person can't just decide to get better. It's not all in their head. They're not considered weak or scary for having an injury. What if there were a blood test or x-ray that showed the medical signs of a mental health disorder? Would it seem more real then? While we can't diagnose mental health with the same kind of tests used for other physical ailments, we can often see the changes in the brain of someone dealing with a mental health disorder. These brain scans not only clearly show the difference when someone is dealing with a mental health disorder, but also how the same people can recover with treatment and their brains can return to normal. Here's a fancy PET scan of the brain showing us what clinical depression looks like physiologically. On the left is a person's brain when suffering from depression. On the right is the same person in a normal state or after they recover. It's a good news before and after story. Some guys are still hesitant to seek help when dealing with a mental health issue. Maybe some don't see the connection to how they're feeling, or maybe they think they can just tough it out. And unfortunately, some might still be afraid of what other people will say about them.
Psst.
No matter what you're dealing with, always remember that there's help out there. Just like we saw in the brain scans, people can get better with treatment. The first step is talking to someone you trust, like a friend, family member, or even your family doctor. Sometimes it takes courage to admit you need help, but everyone needs help from time to time. Things can get better. Reach out and take the first step. Thanks for listening.